good afternoon, and thank you all for coming. First of all, I'd just like to open this up by introducing what I call our regional Trumbull Warren COVID-19 task force, and those include Frank Migliozzi from the Trumbull County Health District, John May, Deputy Health Commissioner from the Warren City Health District, and we have Dr. Shina from the Steward Health Group, and I'm glad we have Dr. Uberti here from the Mercy Health Group as well. The purpose of today's press conference is to bring awareness and a sense of urgency and information regarding the trends that we're seeing in COVID-19 cases in our region. I will point out that since the beginning of this pandemic nearly 2 years ago, we've been meeting weekly. That started probably in March of 2019. And in those meetings, we discussed the case numbers and the effect that it's having not only in our health departments, but also in both of our hospitals regionally, in all of our hospitals regionally. The sense of urgency that brings us here today and prompted me to call this press conference is a result of the surging numbers of new cases that exceeds, in fact, the numbers that we previously have seen since the beginning of this pandemic. And that's why I speak with a sense of urgency. And this, in effect, has caused extremely stressful conditions and overcrowding in our emergency rooms, and also, conversely, with the public demand for the limited supply of COVID-19 test kits. And we'll be able to address all of this today. Having said that, what we do have that we didn't have at the beginning of this pandemic is some weapons, and the most powerful of those weapons being the vaccine. And it's our greatest defense in saving lives. So we're asking everyone, I'm literally pleading with everyone who hasn't been vaccinated to please do so, and to continue to wear your mask in public, because this is simply the best way we have to avert or help address this public health crisis. I'd also like to point out that, these numbers, we're seeing them surge. I'm going to ask people to use common sense, be smart when you're in public spaces, and take all precautions when you're around each other. But the best thing that we can do is get vaccinated. So, having said that, I'm going to turn it over to the people who are on the front lines, and I'm going to start with our hospitals. I'm going to ask Dr. Shina from the Steward Health Group to address the media first. And we'll go in that order, so I don't have to keep introducing everybody.
Thank you, Mr. Mayor. I was up here, not too long ago with similar folks discussing the vaccines and the importance of them. And that hasn't changed. The vaccine rates have gone up, which is good to see, but they could be a lot better. Even with the Omicron variant coming out, and some hopefully good news regarding how its infectivity is a little bit lower, and hopefully the death rate going down, we're still not seeing that right now in the local community. Hospitals are still fairly full. A lot of people in the emergency rooms. But unfortunately, those people that are in the hospital that are requiring extra care, and especially those in intensive care, are for the most part unvaccinated. Upwards of 85% that are in the hospital, and near 100% that are in intensive care that require that amount of care. So to echo the mayor's comments, the vaccine and the boostering is of utmost importance. There are multiple sites in the area. Most of the community knows where they're at. From a Steward standpoint, our offices in Elm Road and Cortland, and also in Austintown at Steward Internal Medicine, those are available there. So again, of utmost importance is the vaccine. It does work. Some of the rhetoric that you hear is, well, I've gotten my vaccine and I'm still testing positive and I still got a little bit sick. Everybody needs to keep in mind that the point of the vaccine is that it's significantly, upwards of 94+%, decreases your risk of severe illness, hospitalization, and most importantly, death. And that's exactly what we're seeing in the hospital. The patients that have not been vaccinated are the ones that are in the deepest trouble right now, and unfortunately passing away. When it comes to the emergency care, we want to talk about appropriateness of where you're going when you feel sick. One of the things that I've talked about quite a few times is when do you go to the emergency room versus when do you go to either an urgent care or your primary care physician. The emergency room should be for emergencies, okay? Patients that are having significant symptoms, whether it's COVID or not, chest pain, significant head trauma, stroke-like symptoms, confusion, those are potential emergencies that need to be addressed in that fashion. Patients with, mild or possibly COVID symptoms, sinus headaches, sore throat, low-grade fever, achiness, or other things such as sprains and strains, and a cough that you want to get evaluated, and your primary care is not available around a weekend. That's appropriate for that setting. Most importantly of all, if there's any question, you call your primary care office. Those are the folks that can answer a lot of your questions. You put you in the right direction. So please keep that in mind. Right now, the healthcare system in particular is being overwhelmed, particularly in the emergency department, particularly on the hospital floors, and especially in intensive care units. So we want to give those providers that are taking excellent care of these patients and saving lives, we want to give them a little break when appropriate. Moving forward, being vigilant from a testing standpoint, there are limited supplies. Going out and getting tested just to get tested is not appropriate. If you've been vaccinated and have no symptoms or maybe came into contact with somebody, that may not be the best option for you. But if somebody has symptoms, and we need to know what's appropriate, whether you're going to have to quarantine or if there's something related to employment or to a kid's school or sports or things along that matter, then of course it's appropriate to get tested. But that's who we need the testing for. The home kits are good to have. They're not totally accurate, but they're accurate enough. But those still will need to be addressed with the proper testing, either at a testing site like we have again in Cortland and at the urgent care in Austintown, or affiliated quick med urgent cares. But there's still follow-up needs to be done there. Again, any question, contact your primary care office. But with the supplies that we have, we need to save those for the patients that are sick. That it's going to make a difference in how they're treated and who they're going to have to go see. That being said, again, echoing the mayor's comments, common sense on both sides of it. If you're sick, stay home. Okay, call your primary care office. If you're not sick and you may or may not have been exposed and you've been vaccinated, there's no sense in running out and getting tested 3 different times. I know it gets difficult when the CDC, for example, changed their recommendations twice in 2 days this week. With the quarantine now down to 5 days if you've been vaccinated, they've actually eliminated the repeat testing requirement that they used to have. So now you go on a symptom-based strategy. After 5 days, if you no longer have a fever, you no longer have a sore throat, you're feeling much better, then you can come out of quarantine and mask appropriately. So hang on tight. You'll listen to your healthcare professionals, and again, call your primary care office if you have any questions. Thank you.
Hello, I'm Jill Uberti. I am the Vice President of Medical Affairs at St. Joe's and Warren Hospital. I also serve as an emergency medicine physician up at Warren. I can't agree more with what Dr. Shina had to say and the mayor. I think at this time we need to think the next step ahead. When you are deciding to go into the emergency department, deciding to go into the hospital to be seen, you need to recognize what you're hoping to get out of the situation. So if you think that you have been exposed and you're going strictly to find out whether or not you have COVID, you may in fact be exposing yourself further to those who are very, very sick. So at this time, we've had record numbers through our emergency department, our highest numbers of COVID positives in our Youngstown Mercy hospitals between the 3 facilities, and record number of walk-in patients through our 8 walk-in clinics and our 2 urgent cares. Each time you go into a setting like that, you put yourself at risk, and those high volumes of patients that are coming through those areas are also restricting the care of others who may need it. As Dr. Shina said, we still are dealing with the heart attacks, the strokes, those people with vascular emergencies, and many other diagnoses. And then on top of that, we have over 50% of our population right now being COVID positive in the hospital, of which I would agree. I would think we're around 80% who have not been vaccinated. And probably what I'm seeing quite a bit of lately is they were initially vaccinated but have not had their booster yet. They are getting more sick than those who have had their boosters. So please, if you're considering getting your booster, I would do so as soon as possible. Again, if you have a concern that you have COVID or that you were exposed to COVID, I think there's nothing more smart to do than to start wearing your mask and to quarantine yourself at home. If you're ill enough that you don't feel well enough to go out, then you shouldn't go out. Whether it's COVID or something else, influenza still kills. We're still seeing influenza. COVID will do the same, just as any other illness. So please, be a good citizen. You may not come down with very severe symptoms, and that's one of the things I've heard most from people who said, I don't feel the need to vaccinate. I don't think people in my age group are getting that sick. That may be something that was true in the beginning stages of this, but we are seeing more and more younger populations get quite ill with it. And even if you fare well, you may expose someone else who in turn could be lethal for them. So please keep that all in mind. In addition to that, I would like to draw some recognition to our EMS providers. They are also, at this time, very stressed, very maxed out on what they're able to provide for the community. Many of them are ill and unable to work, and so those numbers of EMS providers is limited. With the overcrowding in the emergency departments, they often get to the ED and have nowhere to unload their patients, and so the line is actually going out of the building at times with patients waiting to be dropped off. So please only utilize EMS when you feel it's absolutely necessary. And then the moral injury that is occurring right now with our healthcare professionals, whether it be a physician, the nursing staff, the respiratory therapist, the environmental workers who are cleaning our hospital. I have never seen such perseverance in a group of people. However, they all need our prayers. They all need our well wishes. They need to know that they're being supported by the community. Our numbers are down. We all could use a dozen on every floor more nursing. And so I just cannot stress to you enough how important it is that you keep all of them in thought. So thank you very much.
Thank you very much.
Good afternoon. I'm the Warren City Deputy Health Commissioner. My name is John May, and I'm standing before you just to speak on what the Warren City Health District has been experiencing as of lately. The number of COVID-19 cases in the city has skyrocketed. In the last 2 weeks, cases have nearly doubled. The seven-day case data pulled on December 28th showed 567 cases. The 7-day case count data pulled for today is reporting 1,074 cases. Of those figures I just provided, the zip codes that entails is 44481, 44483, 44484, and 44485. We have reason to believe case rates are much higher than reported because of the rapid home tests that are provided to the community. Many of those tests that people have aren't proctored tests, and when those tests aren't proctored and logged or properly documented by eMed, those tests are not recognized by the Ohio Department of Health. A proctored test is basically a test that is overseen by an authorized professional. The Omicron variant is said to be more transmissible and easier to spread. So we believe that is the reason why so many people have contracted the virus as of lately. And we just caution that individuals, as the healthcare physicians have indicated, to just be vigilant and careful, whether it be masking, practice social distancing, all the things that we've always expressed at the start of the pandemic. So far, the tools we have to fight COVID-19 include some of what I just mentioned: masking, frequent hand washing, vaccination, and getting the booster shot. If it's been 6 months or more after your primary series of Pfizer or Moderna, you're due for a booster. If it's been at least 2 months after receiving your single dose of J&J, you're due for a booster. The Warren City Health District continues to offer walk-in clinics every Wednesday from 9 a.m. to 11 a.m. and then again from 1 p.m. to 3 p.m. The Warren City Health District is offering youth vaccinations from ages 5 to 17. The schedule for this month is January 10th and then again January 24th, and the same hours, 9 to 11, then again 1 to 3. The Warren City Health District has rapid home tests available while supplies last. The Warren City Health District continues to offer these tests to residents in need. So we stress these tests are strictly for individuals that feel they have been exposed or experiencing some mild symptoms. We want those individuals to come in to obtain a rapid test. It's not necessarily just a stockpile, but we just want to make sure individuals are making the right decisions before they potentially put others' health at risk. And to call for more information, the health clinic can be reached at 330-841-2596. And before I close, I would like to mention some of the total vaccinations, or the total vaccinations administered by the Warren City Health District. We've administered a total of 8,862 vaccinations. Total pediatric vaccines from 5 to 7 is 250. Hospitalizations have increased by 30.4% since November. And also our death rate has increased. So there's been an increase of 78.6% since October. In the fourth quarter of 2021, we have had the highest death toll by 28.1% from previous 2021 quarters in the pandemic. Thank you.
Good afternoon. I'm Frank Migliozzi, the Health Commissioner for the Trumbull County Combined Health District. Trumbull County is currently experiencing a surge of COVID-19 cases at its highest level since the beginning of the pandemic nearly 2 years ago. From the week following Christmas, our case count reached well over 2,000 at 2,242 cases in a 7-day time frame, which was a significant increase from the week before. Our case rate, our case rate is also at its highest point at 1,152.7 per 100,000, which is up from 794 per 100,000 just 1 week ago. The surge in cases is impacting our workplaces, our schools as they return from break, and especially our hospitals and healthcare facilities as they struggle with surges and staffing shortages. I've brought a graph to show everyone just how we've been trending in the last second half of this year, and you could see it's a significant increase in our cases. With that said, the majority of this surge, especially to our hospitals, can be avoided if we're all up to date on our vaccines, as the majority of hospitalized individuals, as you heard, are those of our COVID cases are those of unvaccinated persons. Unfortunately, Trumbull County is only at the 50% mark right now with completed vaccinations, and not much higher as started vaccinations. We are around the 55% mark. When you look at that as number-wise, it's about 99,000 individuals have completed their vaccination status. Vaccines remain our most effective tool in prevention that public health uses to reduce the transmission of this virus. Keep in mind other effective measures to reduce your risk is to wear a mask when you're in indoor public settings, to practice social distancing as much as possible, avoid crowded areas, use proper hand hygiene by washing your hands and sanitizing them. And when you are experiencing COVID-like symptoms or you're not feeling well, is to stay home. Don't think it's safe to go out because it's not, usually not. If you are not feeling well and need to be tested, and that was a key thing that you heard the two physicians mention, just to be tested, we need to save the testing for those that are not feeling well, so that we know if they are positive or not, and know that they need to be isolated or not. So if you're not feeling well and you need to be tested, Please avoid going to the hospital emergency rooms as they are extremely busy at this time. There are a number of pharmacies, urgent care centers, federally qualified healthcare centers that can test you. And I did complete an updated list of facilities, and you can see there are a number of them that will provide either a PCR test or a rapid antigen test and or both that can take care of that and avoid clogging up our emergency departments. In addition, there are rapid home tests that can be purchased at most pharmacies, and the Trumbull County Combined Health District has received and distributed nearly 5,000 test kits up to this date, and that started around the middle of November. We've distributed to our schools, to various agencies, to political subdivisions, as well as the general public. However, as the demand increases across the state, the state has established an allocation formula for all local health districts in the amount that they will be receiving, because they just cannot keep up with the demand themselves. Thus, the Trumbull County Combined Health District was notified yesterday that we'll approximately receive about 400 test kits per week, which is not nearly, it's a fraction of what we've been requesting in that. So there are going to be a small amount of test kits to be distributed around. We will continue to distribute them from our office as they arrive, but there will certainly not be enough to meet the demand. So please consider these testing sites that we have provided you. We are placing, if you want to place a request, we have a list that we're keeping. With the limitations that we have, we will be only offering one kit per individual at this time. You can call our office at 330-675-2489, option 3, to request a kit, and you'll be placed on the list, and as they come through, we will distribute them. And finally, if you have not been vaccinated or if you're in need of a booster, we continue to offer vaccines every week at the Eastwood Mall, every Tuesday and Thursday evenings from 5 to 7 p.m., as well as the first Saturday of every month, starting from 10 to 12. And you can register ahead of time on Get the Shot, or we will accept walk-ins to those, and we offer all 3 vaccines as well as the pediatric vaccine at every one of those clinics. Thank you.
Thank you. I'd like to thank all of our Dr. Shina, Dr. Uberti, Frank Migliozzi, and John May for giving those presentations on what we're seeing throughout the county. It's interesting that, we didn't get together but the information was so consistent. Everybody's seeing the same thing. So that's why I speak with a sense of urgency. And I guess the best close this before we open it up for questions is, this public health crisis is everybody's business. I don't care where you stand politically or where you stand in any form or fashion on your position. We all have a hand in us getting back to normalcy. It's all of our business. It's all of our responsibility. So once again, I'm just pleading for the community to respond like we generally do in the Valley, with diligence and a sense of purpose. So having said that, I want to thank the media again for coming. I would thank Director Colbert for setting everything up. Councilman White, we have our police chief, because this is not only a public health crisis, it's a public safety issue as well. So I want to thank you all for coming, and I'll let these professionals answer some questions. If you have anything for me, I'll try to do the best I can. Thank you very much.